is everyone talking about their pelvic floor lately? This really wasn't something we ever heard discussed 10 years ago, but in reality, 1 out of 2 childbearing women experience pelvic floor dysfunction. And thanks to the interest in menopause, we're learning that your likelihood increases as estrogen levels decrease.
The hard part about pelvic floor dysfunction, though, is that it doesn't look the same in every person. In today's episode, we break down what the condition can look like, what symptoms may be, and talk through the recommended treatments. Bonus, Brierley shares a surprising treatment that worked for her. Let's dive in.
Ooh, today is going to be such a good episode. I'm so excited. I have a lot of personal interest in this topic. Although I will say, I did not suggest this as today's topic. You suggested it, Carolyn.
Well, and not to pick on you, but when you were going, you left numerous Voxers, which is an audio messaging system, with me and another friend about your pelvic floor issues this week, which have been at bay for a while. But if you follow us, you know they really flared up this spring.
Oh, yeah.
And if you, was it this spring? It was this spring.
It was like February.
And if you...
And it really peaked in March.
It really peaked in March, so much so that you got prescribed Valium. Please go back and listen to that rant if you did not, for your pelvic floor issues. But you were talking so much about it on our messaging system this week that I was like, why aren't we doing an episode on this? Because I feel like pelvic floor issues or something, they weren't even on my radar until about, the term even wasn't even really on my radar until about 5 years ago.
Yeah.
And I feel like now it's everywhere. Maybe it's our age.
No, I do think it's everywhere because I think there's a much bigger trend of women after they give birth to a baby will go and do like pelvic floor rehab.
Well, it's not just assumed, oh, you had a baby. This is just a side effect.
Right.
Women aren't dismissed anymore.
Just do some Kegels and it'll get itself back.
I feel like I do not have pelvic floor issues, I don't think, or I didn't think prior to learning a little. I may actually. I may have the opposite of what you have. And we'll talk about that. But
when your bladder has eyes.
Yeah. And we'll get to that. But I know a whole host of people who have said, "Oh yeah, I have pelvic floor issues," and now even in research, I'm seeing, like, I was reading something about a respiratory thing, and there was a link to pelvic floor issues, and I was like, "What?"
Yeah.
So it's really kind of interesting. So we thought, because it's affecting so many women, and the majority of our listeners are women, and typically around our age, maybe a little above or below, we thought, well, let's bring some light to this, because I didn't even really know what the pelvic floor was.
Yeah. Well, and here's the other thing is that anecdotally, like, I can say that it has a huge impact on your mental wellness.
Yeah.
But also, when you read the research...
Obviously, with the number of messages you left us this week. I'm just messing with you.
Fair. That's totally fair. I mean, I gave you all the play-by-play. But even when you read in the research, they talk about how it has this mental health component to it because it really can affect quality of life.
Well, and it's like kind of like your silent diseases. No one knows you're walking around in this pain.
Yes,
or
exactly.
You're walking around peeing on yourself or whatever your pelvic floor issue may be. But with you, it's been a lot of pain.
It's been a lot of pain. Yeah.
Okay.
All right. So,
what is the pelvic floor? What kind of issues? Why should we even know about the pelvic floor, or what does it do?
Oh my gosh. Okay, so the pelvic floor is a group of all of these muscles in your pelvic area, and they go crisscross in every which way. There are a bunch of them, and there are nerves, but it is like a massive group of muscles that support all those organs in there, like your bladder, your anus, your urethra, and then, like, for us ladies, like our uterus and and our cervix too. So it keeps everything,
the vagina
in place where it's supposed to be. Yeah. And it's like, if you've been pregnant,
keeps things from sagging.
It keeps things from sagging
or protruding outward. I did see the word protruding with some of these issues. Yeah.
And so if you've if you've been pregnant and if you've birthed a child, even if you didn't have like a vaginal delivery, but you had a C-section, at some point you do feel like your hips widen, things like that's your pelvic floor like expanding,
those muscles
and
relaxing,
yes, which is why like relaxin is a big hormone at that time. Okay, anyway, so it has a very, very important function, but
so it keeps everything in place, but it also plays a role in bladder control, also sexual function.
It plays a huge role in sexual function, which I have to say I did not realize until I started experiencing my own pelvic floor issues.
Okay.
And one of the things that I did not know until we were researching this, because I have not fully experienced I have not experienced it, is it can affect your bowel movements as well.
Okay.
So you can have incontinence or you can have the other way, which could be constipation.
Interesting.
Yes.
I never really thought about it affecting number 2.
Yes.
Okay.
Yeah.
Please go on.
So,
now there's these muscles. We got to remember this is a massive group of intertwined muscles. It kind of seems like the issues arise for one of 2 reasons. Either the muscles are too weak
mm-hmm.
and aren't able to do all their functions like they should, or they're too tight.
Yes.
And wound up.
Yes.
Which is your issue.
That is my problem. Yes. Yes. So, and your symptoms as a result of whether or not they're too tight or too loose, can be are very different.
Yeah.
I mean, think about like when you're squeezing something versus when it's incredibly relaxed. Like, so when you're, go ahead.
Well, so I was going to say, so I'm guessing like if yours are too loose, that they say some of the symptoms may be feeling like a bulge or something coming out, actually,
yes.
which is kind of graphic of
yep.
the vagina.
Yep.
Like urinary leakage, urine
mm-hmm.
leakage.
Mm-hmm.
I even read like stool leakage.
Mm-hmm.
They say urine leaking again with like coughing, laughing, exercising. Hello. They say heavy, full, painful, or aching sensation like in the vagina. I'm assuming that's more the opposite. That's more what you have.
Mm-hmm. Yeah.
So more the pain is with the too tight, and then more the leakage or protruding is with the too loose.
Yes. Yes.
Okay.
But the pain and the heaviness also comes with too tight. So I think I described it to you at one point where I said I felt like I was carrying around a kettlebell in my pelvic region. And it wasn't like it felt like it was going to fall out. It just felt like I was carrying a kettlebell around. And I was like, this is so uncomfortable.
And you feel like you have to go to the bathroom all the time?
Mm-hmm. Yeah. So it also presents with UTI-like symptoms.
Okay.
Where and the hard part with that is you don't necessarily know if it's your pelvic floor, like your pelvic floor muscles, whether like they can be really tight, but you also can be having bladder spasms at the same time. 2 totally different treatments for those, basically. I mean, one is like relaxing your pelvic floor and all of those muscles. And then for bladder spasms, it's really about dietary changes potentially, and also like a medication, a prescription for bladder spasms. So I have been down at the expense of everybody listening and me giving them too much information. I've had the bladder spasms. I've had the too tight pelvis. I've had all of the what's called the hypertonicity.
Okay. So let me break this down for people. Basically, when Brierley goes through any major life stressful event, her pelvic floor muscles tense up.
Yes.
Which caused earlier in life, I guess 6-7 years ago, caused her to start having, during a very stressful period, bladder spasms. Mm-hmm. Which I think is, why you brought that, the 2 things up.
Yes.
She went through another period earlier this spring, and that's when the pain, the kettlebell feeling, the muscles acted up again, and you had these different symptoms that were more directly related to those pelvic floor muscles tensing up.
Yes, exactly.
Yes. So, yeah.
So
did I get that right?
You got that right. And the thing is that they are both pelvic floor dysfunction.
Okay.
But they also are what they call like hypertonicity, so where everything is just more tight.
Okay.
Then there's hypotonicity, right, which is
where everything's
loose. And I think that most people hear of the hypertonicity one, like symptoms more often.
What you have?
Sorry, hypotonicity, not what I have. They hear about the other one more often.
Let's just use tight or loose.
Let's use loose. Okay.
So I hear more about the loose symptoms.
They hear about more about the loose symptoms.
Well, I'm wondering because, I've done a rant before. I'm tired of peeing on myself.
Yeah. Well, okay. So there are a bunch of factors that can lead to having like pelvic floor dysfunction, but also when I go through some of these factors, you're going to realize that a lot of them are what they increase the looseness.
Okay.
Right?
Okay.
Okay.
Well,
so
let's go through these. Some of these probably won't surprise people.
Yeah. So childbirth is one, right? Okay. That totally makes sense. Like that whole area is stretching and growing and there's a heavy baby in there. If you have a child that is born, in like the 90th percentile, they say that can increase your risk of having pelvic floor dysfunction. I love this term. It's so medical, parity. But basically the number of children that you have affects it as well. That's a risk factor. And in fact, your risk increases from 1 to 1.6 with one childbirth, and then it increases significantly after each new birth. Then you layer in, what if you had like a tear and you had to have a repair? That increases your risk too.
So, like, I know you don't watch reality TV, and they aren't on TV anymore, but the Duggars, she had like 20 kids.
Yes. I mean, I'm surprised she probably really,
must wear a Depend.
I mean, I would probably think she needs to.
Yeah.
No shame on her for that, but like your body can only do so much.
Our pelvic floor muscles are done.
Yeah. So, and that comes to the next one is like consistent pressure on your pelvic floor. Yeah. So that could be from multiple burrs. That can be from being overweight. Like they do say sometimes losing body weight, if you're overweight, can help with your pelvic floor dysfunction. If you have chronic constipation.
Interesting.
Because think about it, it's putting pressure in that area, right? Lifting heavy. Or this one, I just can't believe this one. Chronic coughing, but I mean,
there's some. I think there's some blood pressure medications that cause you to cough.
Oh, really?
As a side effect.
Oh,
yeah.
Interesting. Okay,
yeah.
So that would make sense.
Yeah, like that.
Okay, getting older. That happens in men and women, but there is an association between our estrogen levels dropping and increasing your pelvic floor dysfunction.
Shocker.
Which I think is another reason why we're hearing about it, because all of these like perimenopausal women
so much interest in
are talking about it because they're like,
finally,
I saw this woman, it was months ago, but these two women that I follow on Instagram, and they're talking about how they spent the whole day driving around because they thought their friend, the one of them, had this like horrible UTI, and come to find out, no, it's a pelvic floor problem that she has. And so they were like ranting about it. And I, of course, am in the middle of going through it. And I'm like, oh my gosh, me too.
It's interesting. And again, it's kind of like all the menopause stuff. Like, no one's really talked about these pelvic floor issues, but women have been dealing with them forever.
Yeah, forever.
But it's like, it's kind of just been pushed off as, oh, you're getting older, or, oh, you've had several babies, or...
Yes, this is common. This is normal. This is typical.
Yeah. Or maybe in cases like yours, just kind of dismissed. Because when you went to the doctor for your pain, you were in a lot of pain for a while. They didn't really have any solutions for you.
Well, and they also didn't have any immediate solutions. The only immediate solution I got was the Valium. I mean, otherwise they're like, you need to go to PT and you need to, and I'm like, okay, well, great. But PT takes multiple weeks for it to take effect. Like, can you give me something now?
Yeah. And we're going to share towards the end what actually worked for Brierley, because it was nothing her doctor really recommended.
It was not. It was a lot of trial and error.
So,
all right. Okay. Two other things that increase risk would be surgery, which I feel like sounds very basic, like take a hysterectomy, for example, or just weak tissues in general, which can be a genetic thing, or just generally like we talked about, the drop in estrogen, can thin those muscles, that kind of weak tissues.
Yeah. Interesting.
Yeah.
Okay. So, and then you found an interesting chart looking at which women are most affected. And it looked like the majority of women that are affected by pelvic floor issues are going to be women 65 and older.
Mm-hmm. Yep. And then our perimenopausal and our postmenopausal women
are close
behind that. Now, I did find another statistic that said that up to 50% of childbearing women, so the problem can experience pelvic floor dysfunction. A lot of the statistics, when you're reading through them, they're saying that they feel like these could actually be underreported because there is a lack of awareness.
Yeah.
And 16% of men actually suffer from pelvic floor dysfunction, which I thought was interesting. There's another subgroup of women that experience this, and it is like high impact female athletes. So
I saw that. That's really interesting.
Yeah. And I'm not talking about like just people who are doing like CrossFit, although that can, that can increase it. Like they did a study on like, I think it was swimmers, collegiate swimmers. And the rate was pretty high in that group of having pelvic floor dysfunction.
Yeah. It's so interesting. It's just interesting to me that we've never really talked about this as a society until, recent years. Okay. So what are your options? And, one thing I was thinking about is like, with it affecting a large or over about half the population of women 65 and older, does staying active and fit, do you think that has any reflection on like your pelvic floor health, or do you need to do exercises specifically for your pelvic floor muscles? Or does having sex regularly, does that keep them healthy? You know what?
Yeah.
Is there anything you can do, or you just wait till you have an issue and then deal with it?
No, there are definitely things that you can do. Obviously, I'm not a physical therapist and I'm not a urologist. So let's take everything, take my opinion with a grain of salt. But the biggest thing, I think, when you look at options for treatment and management is you really have to know which one you have. Is it too tight or is it too loose? Because if I went and started doing Kegels, no, bad idea for me. Because my issue is not strengthening it. It's not strengthening any particular part of the muscles. Like, that's a no for me.
So if you don't know what Kegels are, well, go Google it. But
go Google it. I'm not going to explain it.
Muscle contractions that strengthen your pelvic floor muscles. And so what you're saying is because yours are already too tight, you do not need to be working out your pelvic floor muscles anymore. Correct. That's the last thing they need. Whereas people whose are too loose, that is going to help.
Yes.
The Kegels are going to help.
Yes, exactly. So let's start first with things that you can do that it doesn't matter which one you have.
Yeah.
There is a large component of diet. And I did this. I did some elimination stuff. I did a food journal. The nice part for me is that I didn't really have to cut it all out. I just kind of played with it one day versus the next day. You could do a total elimination and put it back in. But so alcohol is going to bother it. Caffeine is going to bother it. On a lot of the part about and also citrus foods or citrus drinks. And so what they say is that it's the caffeine and the citrus, the acidity of those are going to irritate your bladder, and that is going to irritate the whole issue. Things like tomatoes. I personally would say nightshades in general could be problematic for me. If I'm really inflamed, nightshades are going to make it worse.
Let's get an inflammation standpoint.
Correct.
Your body's inflamed when these muscles, like in your case, your body, as muscles are inflamed, so you've got inflammation in your body. So your nightshades can trigger inflammation in some people, and they're more prone to do so if you've already got underlying inflammation in your body. So
exactly.
Makes sense.
Yeah.
Makes sense.
Artificial sweeteners.
You know, that is interesting because there is a period where earlier in adulthood where I consumed more artificial sweeteners, or I don't consume any now. If I use anything, I use a little stevia, but like your artificial sweeteners. And this is way earlier in life, and I felt like I kept having some like small amounts of incontinence, and I was reading on it, and it said artificial sweeteners, and I cut those out, and it fixed it.
Yeah. Also, all I can say is bubble water, but carbonated drinks.
Yeah.
And so I have a really good friend who had more like bladder cystitis type issues, and she was a big Diet Coke addict, and she cut it out, and it has again, also in her early 20s, it probably coincided with some stress too. And she saw like a very swift, massive improvement. So spicy foods too. And they say cigarettes, I can't speak to that. But so spicy foods, anything that's like caffeine, alcohol, citrus, artificial sweeteners, and then tomatoes and other nightshades.
Well, I think nicotine, like if you think back to acid reflux, they tell you to avoid nicotine because it relaxes those muscles and allows the reflux to come back up easier.
Yeah.
So I would think if you were dealing with pelvic floor muscles that are too loose already, it's probably going to have some kind of relaxing effect, which would make things worse. Yeah. Look at us connecting all the dots.
I know. We're good at this. Okay. So otherwise, the other lifestyle modifications do come down to what you have. And so like we talked about Kegels, weight loss can help too if you are overweight. Core exercises to strengthen the pelvic floor and support. But here's the thing, is that you really want to work with like a professional, like a physical therapist, because it's not just about like doing crunches and like the exercise. When I did do PT, even though mine was for relaxing, the exercises that they had me doing, I would not have figured that out myself. Let's put it that way.
Okay. They're not your typical. Well, my favorite takeaway from your PT is that your physical therapist told you needed to go lie on the couch every night after your girls went to bed and drink wine.
Yes.
A glass.
Yes. But, so a big part of mine was stress reduction.
Yeah.
And figuring out what I needed to do. And we talked at length about, she said, well, what do you do to reduce stress? I said, I go for a walk. I said, I have walked the streets of Homewood like you would never believe. And she's like, yeah, you can't do that. And I was like, what do you mean? And she goes, because it just tightens up your hips and your pelvic floor. And she's like, what else can you do? I was like, sit on my couch and drink wine. She was like, exactly that. If that works for you, you're doing that every single night. She's like, do you want some chocolate? I was like, no, I don't care about the chocolate. She's like, fine. Sit on the couch 30 minutes after your kids go to bed. No interruptions. And I was like,
great.
This is doctor prescribed? Okay.
So you, medication-wise, you didn't find much that worked. And the vaginal Valium did not even do. It helped a little, maybe.
It helped a little. It helped a little to relax. I don't love the way Valium makes me feel, and so it's not like swallowing a Valium, but you do get a little bit of that like I had an extra glass of wine feel. But when you are in a lot of pain, it works. It really works. I've done the antispasmodics for the bladder. If that is your true issue, that does work. It just takes a little while to build up in your system. So it's not like an immediate effect. And then there's over-the-counter stuff like Peridium and other like
do those do much?
Yeah. If you're having intense UTI symptoms, they can take the edge off.
Which is how yours felt a lot.
Bit.
And you were always like, could I have a UTI? You're like,
oh my gosh.
When this is going on for several months, you're like,
yes.
Which is it? And that's kind of where you were this week.
Yes. And I've walked around for weeks at a time with undiagnosed UTIs thinking that it was my pelvic floor. So that's also kind of the catch-22 of pelvic floor disorders is that if something else is going on, you can't figure it out.
Right. Well, and this week, I hope this is okay to share, but we were so excited.
Yes.
When we got your urine culture back, and it was a UTI, and we were like, yes!
Yeah.
Because your pelvic floor was in so much pain.
Yeah.
And it felt like a UTI, but you didn't know
if it was. I had never been so excited to swallow an antibiotic in my entire life. Well, I could tell in your mind
you were going back to where you were in March.
Yes.
When the pelvic floor stuff was really bad. And so I was very glad that there was a quick solution and an antibiotic could
fix my problems.
Yes.
Okay, now another one that I have not tried is you can do estrogen suppositories as well, or like an estrogen cream. Again, I have not tried it. I know people who have. My urologist is very much in support of it, but
I'm assuming like hormone replacement. Like
Mm-hmm.
I get estrogen.
Yeah, exactly.
Inserted. Yeah, so I'm assuming, yeah.
And then, I think the third big one is this category. They call it in research studies, they call it like manipulation. And that is your physical therapy. There's something called biofeedback, which you asked me if I've done. I've not ever done it, but it's like training. It's like retraining your pelvic floor. And I'm trying to think about what.
Put like electrodes up in you, right?
Yes, it's something about there's electrodes that's combined with strengthening and relaxation, but then there's like a visual and or auditory component so that you can basically teach yourself to you can it's like a mental training exercise to then teach your body to respond. Because again, it's these funky muscles that you don't necessarily think to your brain doesn't necessarily always know how to turn them on or off, right?
Yeah.
And so there's a component with the biofeedback of of learning.
Well, like how were you to know that your pelvic floor muscles were very tense and needed to relax?
Correct.
Exactly.
I did not know.
So I found this really interesting because you tried everything back this spring, and it was several months that were pretty bad. And
I think I tried everything on this list that we just talked about except for Kegels and biofeedback.
Yeah. There was one thing that really came across though as really just finally addressing the issue, and it surprised both of us because nothing else really had the effect that this did, and it's acupuncture.
Yes. Acupuncture has been single-handedly the best way that I have been able to manage it and manage the stress. Like across the board. And I still go. I have read that you really don't necessarily need to go to acupuncture unless you're actively trying to deal with something. I would say maybe once have I walked in there and I haven't been like really under some type of stress that warrants being treated. But I go much less frequently now. But anyway, acupuncture, I found that it really worked. I got the recommendation from a friend. And then we looked at the research. And after I already had, because by the time I went to acupuncture, I was like, I will throw anything at this. I don't care what the research says. You could have given me a Chinese herb straight out of the ground, and I would have chewed it. Like I was that desperate. But anyway, so then I looked at the research, right? And some of the research I found was in men, which was a little disappointing to me, but that's okay. And they were looking at chronic pelvic pain, what they call chronic pelvic pain syndrome. And they gave, it was small studies, but nevertheless, where they gave men, they went to acupuncture twice a week for 6 weeks. And what I thought was interesting, it said they received 3 sets of acupuncture points for a total of 30 points. When I don't really know what that means, but if they only touched 30 different points, I mean, my acupuncturist pushed like 50 or 60 needles in me.
Oh, wow.
It was like he and I have counted before. At minimum. I've had like upwards of that sometimes. But anyway, so I'm like, okay, to me, if this means they had 30 total needles, that's not what I would consider a very high dose. But nevertheless, they said that 92% of patients had more than a 50% decrease in their pain index, basically, or their symptom index. And then 83% of patients had more than a 75% subjective improvement.
That's impressive.
Yeah. There was another study that I thought was really interesting. This one was blinded. And what they did was they gave them either and Carolyn and I love a blinded study, right? Because we're really removing the placebo effect here when that happens. So what they did was they either did acupuncture or they gave them sham acupuncture. I don't really know what sham acupuncture is, but I can tell you as someone who has experienced acupuncture, if they put it in the right spot, you know it. And sometimes he'll remove the needle and put it and like and move it around. And then he's like, because really what it feels like is that spot is lighting up at that time. It's not painful, but you just know what's happening. So I imagine sham acupuncture is like put a bunch of needles in you, but I'm not actually hitting any important spots. Okay, so 90 patients went into this study. They got 30-minute treatments twice a week for 10 weeks, and then they were followed for another like 6-ish months or so. And what they found was that the acupuncture was twice as effective as the sham acupuncture, which I think is fascinating. And then they also had those who received the actual acupuncture had this better long-term response rate, 20 plus weeks after the treatment. So, yeah.
And we didn't, there really isn't enough info out there to know if like acupuncture is going to be, evidently it was very effective for you because yours were too tight. I don't know if it had the same effect on those where it was too loose.
Right.
But it looks like your best bet is just to try a bunch of different things. Yeah. Depending on what type you have.
Yeah, absolutely.
Interesting.
It was really, it's really been quite a journey. But so insightful, and I do love the fact that there were that this like, let's call it an alternative medicine approach is what worked best.
Well, and I love that it so overtly worked. Like it's so usually a lot of alternative therapies you may think they may help some, but it's not always very clear. Yeah. And it was pretty clear in your case, like, oh my gosh, this is making a difference, a big difference.
Yes. And there's also a whole host of other things that I tried that we haven't even discussed. Like, I've tried supplements. I've tried the Chinese herbs. I've tried teas. I've tried heating pads. It's kind of wild. But acupuncture was the biggest. And when you're really having a flare, dietary modifications make a big difference.
Interesting.
Yeah.
Well, thank you for sharing.
You're welcome.
Thank you for bringing me on this pelvic floor journey with you.
I know. I mean,
for the past few months.
Yeah, you're basically an expert now by proxy.
Okay. Well, hopefully this helps some other people or helps people understand more about the pelvic floor. Until next week.
Bye. Thank you so much for joining us for the Happy Eating Podcast. I'm Brierley Horton.
And I'm Carolyn Williams. If you liked this week's episode, then don't forget to rate and leave us a review on iTunes. And be sure to hit the subscribe button so you'll never miss a new episode.
We can't wait to have you back at our table next week for a brand new episode. Bye.
Bye. The contents discussed in the Happy Eating Podcast, such as advice, studies, text, graphics, images, and other material discussed or presented on the site or podcast, are for informational purposes only. Content is not intended to be a substitute for medical advice, diagnosis, or treatment. Always seek the advice of your mental health professional or other qualified health providers with any questions you may have regarding your condition. Never disregard professional advice or delay in seeking it because of something you have heard on the Happy Eating Podcast.
If you are in crisis or think you may have an emergency, call your doctor or 911 immediately. If you're having suicidal thoughts, call 1-800-273-TALK, that's 8255, to talk to a skilled trained counselor at the National Suicide Prevention Lifeline. If you are located outside the United States, call your local emergency line immediately.